Oh, hi, I didn't see you there. I'm Katie, and I'm an occupational therapy student at the University of Mississippi Medical Center. I was just reviewing the OT Journey of Hope, but let me just move this mountain so we can get started. Today, we're going to talk about a protocol for a commonly seen shoulder injury.
My name is Emily, and I'm also an occupational therapy student. And as Katie mentioned, we're talking about a treatment protocol. But you may ask yourself, what is a protocol? A protocol is a set of guidelines that occupational therapists use to determine the do's and don'ts of their treatments on a week-by-week basis.
Last, and definitely not least, my name is Stephanie. Some of you know that occupational therapists work with a wide variety of upper extremity diagnoses, but today we're going to shed some light on specific treatment interventions following a rotator cuff tear.
But first, let's do a quick overview of what the rotator cuff is.
The rotator cuff consists of the supraspinatus, infraspinatus, subscapularis, and teres minor. These four muscles act as the primary shoulder stabilizer and pair with the deltoid to maintain the balance of the force couple. If compromised, pain and limited range of motion can disrupt functional daily activities.
Now that we've brushed up on the rotator cuff, here's an overview of treatment following an arthroscopic repair. First, the therapist needs to communicate with the doctor and follow the protocol for the specific type of tear that was operated on. Next, remember it is important to protect the mobility of all the surrounding joints, like the acromioclavicular and the scapulothoracic joints. Also, educate the patient on precautions and safe ADLs using the pendulum exercise. Treatment will begin with focus on decreasing pain, inflammation, and edema. Next, it will focus on passive range of motion, and then it will progress to active range of motion. Remind your patient not to compensate during any activities or exercises. Finally, treatment will be on restoring the patient's strength and function.
There are 4 phases of healing following surgical intervention for rotator cuff repair. The immediate post-surgery phase begins post-op day 1 and usually lasts until day 10. The goals for this phase are to maintain integrity of the surgical repair, diminish pain and inflammation, and begin early passive range of motion. It is important to educate your patient on specific precautions to follow as well. During the initial evaluation, it is important to discuss the course of treatment, identify patient goals and interests, build rapport, and address any possible questions or concerns. Next, you should emphasize the importance of patient compliance with sling wear, range of motion limitations, and general precautions. You may also discuss adaptive dressing and other similar compensatory strategies that will facilitate the ultimate healing experience. Treatment will start with passive range of motion in supine. It is important to maintain full range of motion in all the unaffected joints, including the hand, wrist, and elbow. Passive shoulder flexion should also be limited to 140 degrees, and external rotation should be limited to 40 degrees during the first week of treatment. The second phase is called the protection phase. It begins on day 11 and continues through week 6. You want to continue allowing the soft tissues to heal while gradually restoring full passive range of motion. You also want to reestablish dynamic shoulder stability. Addressing pain and inflammation and avoiding overstress on the joint are also important to remember.
Dynamic stabilization drills are a unique treatment tool that build resistive strength in the shoulder girdle and increase the stability of the humeral head. This exercise can be done in shoulder flexion at 90 degrees as well as internal and external rotation. In addition to isometric contraction exercises, overhead pulleys are a great way to increase mobility of the affected shoulder joint when performed passively. Beginning week 3, the therapist may allow the patient to perform unresisted isotonic elbow flexion. The patient should also be able to perform full passive range of motion in all joints and all planes. When approaching the end of Phase 2, the therapist should incorporate active range of motion exercises into the patient's treatment program. Shoulder flexion, shoulder abduction, internal and external rotation, as well as bicep curls and rowing are the recommended exercises to follow during this phase. In addition, the patient should continue following all of the precautions mentioned in Phase 1.
Next is the third phase, the intermediate phase. It starts at the beginning of week 7 and continues through week 14. During this phase, goals for your patient will be to acquire full active range of motion and dynamic shoulder stability. You will also want to focus on gradually restoring shoulder strength and power while incorporating functional activities.
This phase has an increased list of activities and modifications to those already addressed in previous phases. It is important to continue stretching dynamic stabilization drills and to initiate an isotonic strengthening program with pain-free motion. At week 8, if the patient has progressed, the therapist may grade the exercises accordingly by performing them in gravity-resisted planes.
The last phase is the advanced strengthening phase. This phase begins at week 15 and ends at week 22, although it is not uncommon for patients to be discharged between weeks 8 and 12 with optimal recovery. The advanced strengthening phase is especially important because it emphasizes maintaining full, non-painful range of motion. You also want to enhance functional use of the upper extremity to promote gradual return to interest in activities.
In the last phase, the patient must continue range of motion, stretching, and strengthening to maintain the full range of motion that has already been achieved. Shoulder plyometrics may be initiated in this phase. Sports, such as golf, tennis, and swimming, may also be initiated if appropriate.
My soul rises up when the sun sets.
Okay, so today we're going to talk to you about common shoulder. Week 15 and ends at week 22. Crap. I was going to say to allow for gradual return. I want to enhance functional use of the upper extremity to allow for gradual return to interest. I can't even say that. Especially important because it emphasizing. Why is it so hard?
So how did the surgery go?
I was asleep.
I like that angle better. No, Katie. Katie, what?
Video over there?
Yeah.
Well, I have to come over there then.
No, you don't. I'm trying to practice right now.
Oh.
There are 4 phases of healing. Follow it. Addressing pain and inflammation and avoiding overstress on the joint are also important to remember.
Now that we, surrounding joints like the acromioclavicular and the joints like the acromioclavicular and the scapulothoracic joints.
Let's do one more time.
Patient not to compensate.
Wait, I'm uncomfortable watching that.